Uh, Very offbeat topic. At an outset, I would like to thank Bhopal Menopause Society as well as IMS for including such a offbeat topic in the conference. To begin with, I would like to thank Dr. Bhupendra Palan. Is a senior hypnotherapist, my mentor and guru. So basically, there is a disclaimer that hypnotherapy or hypnosis is not what is a myth. I am not a black magician and I don't have any skill by which I can extract some information from your brain. So hypnosis is just a psycho-physiological condition which is characterized by enhanced focal awareness, reduced peripheral awareness, reduced critical analytical stereotype information processing, enhanced uncritical holistic creative mode of information processing, enhanced suggestibility, which is very important, decreased muscle tension and movements, intense and sensitive relationship with the operator. So basically it's a state of consciousness involving focused attention and reduced peripheral awareness to enhance capacity of response to suggestions. And the hypnotherapy is essentially communication of the ideas and understanding to a patient in such a fashion that he will be most receptive to the presented idea and thereby motivated to explore his own potential. This is very important. Hypnotherapist is doing nothing to the patient. He is just exploring the potential for the control of his psychological and physiological response and behavior. So there is a state of trance which is induced in hypnotherapy. And here, because we are talking menopausal issues, we will be just touching stress, emotional problems, insomnia, depression. So the whole talk, mostly hypnotherapy, there is no like in this 10-15 minutes, I cannot teach how you can give hypnotherapy, but I'll be giving some basic ideas on which this works. So basically, this human life, the journey between birth and death, has relationship. The fundament you need to understand is, if you understand some spiritual aspect, that is soul consciousness. So if you live in soul consciousness, probably many of your problems will get resolved. And in this life, this soul develops relationship with these 7 fields of life: universe, society, profession, family, body, mind, and intellect. And each of this relationship will give rise to some desire or expectations. So stress, where this stress comes is in every situation or event, it's like a stressor and it demands for some adjustment. And in response, the mind will create some thoughts and feelings and the body will have some behavior and biology. And there is some outcome to this stress and event. If the outcome is negative, it will lead to some kind of negativity or illness. If the outcome is positive, it will lead to self-development. So stress management is nothing but going from distress to eustress. Something you need to know is that stress is cumulative. So when you come to this menopause age, basically whenever from childhood you develop some kind of stress, the adaptability to stress goes down. And we always feel that when we cope up with the stress, we come to the baseline, but it is never like that. So as you grow up, you never come to, your stress level or adaptability never comes to baseline. So the threshold to the stress as you grow up decreases. And at times, or when there is menopause or when there is an elderly age, your threshold is very less. So in elderly people or in perimenopausal age, the threshold is so less that if a small stress is given to that particular person, then also it will be a big event for them. So stress management system, basically it is related to awareness. There is something known as immediate handling and long-term handling. We are not going to detail. Now the basic principle of hypnotherapy in our talk would be the subconscious mind is a seat of emotions which are stored with different beliefs. So the reprogramming of subconscious mind with empowering belief would help in treating problems during menopause. Now if you see human mind is like an iceberg. So consciously what we are talking is only 20%. Almost 70 to 80% is the subconscious mind. So every event or situation is appraised with some kind of belief in subconscious mind. So whenever there is some event or situation, we would like to create some thoughts, feelings, which will lead to behavior and biological process. Now all these thoughts and feelings are generated from subconscious minds, and the beliefs or the frames of references programs which are there stored in subconscious minds. Now what a belief can do, or how a belief is created. Belief is like a table with 4 legs. These are some reference legs. So now these reference legs, the most important reference leg is your personal experience. Second leg is information, and third leg is imagination. So with these 3 legs, and there is some strengthening of the leg. The most important strengthening is emotional loading to that particular leg. If there are types of leg, more than one legs are involved. And third is repetition of legs. So you have bad experience repeatedly, you have some bad informations you are getting. Now what a belief can do. A belief creates a filter between conscious and subconscious mind. So there is like, people say there is wrong belief or right belief. There is nothing like wrong belief or right belief. The belief needs to be either empowering or disempowering. So empowering belief will give you positive thoughts, healthy feelings, motivation. And disempowering belief will lead to wrong type of thoughts and feelings. There is some good thing like Martin Seligman has nice way of questioning the validity of your belief. There are 3 P: permanence, pervasiveness, and personal experience or personal. So by this you can break a disempowering belief. A small example. So always examiner asks me from the topic which I have not studied well, or there is some bad experience. So the thing is, it is not always. It is sometimes, if you try to question that belief, it is sometimes that the things are asked which are not been studied by you. It is not always with me. It can happen with any other person also. And it is not that everything is asked out of the topic. So in this way, you can check your belief and you can change your belief. So you have to convert your disempowering belief into the empowering belief, and that particular empowering belief is stored into the subconscious mind. This is how we reprogram our subconscious mind, and we change our thoughts and feelings. The emotions get changed and the behavior gets changed. One more important thing that needs to be understood is information substance. So you all know there are 4 groups of chemicals: neurotransmitters, neuropeptides, hormones, and immunotransmitters in the body, which creates an internal environment which is known as psychobiological state. Now relative concentration of this chemical changes moment to moment with every thought and every feeling. It is this biochemical environment which decides functioning of every cell in the body through gene expression. Unhealthy emotions like anger, fear, tension, frustration, guilt, depression will make the internal environment unhealthy and thereby cause disturbance in functioning of biological system. The memory of every experience is encoded with the psychobiological state at the time of occurrence of the experience. This creates a kind of learning which is known as state-dependent learning. Now, recall of the experience will create the same psychobiological state associated with a specific pattern of thought, feeling, and biological behavior. So, these are few background on which we treat patients in hypnotherapy. Now, one more important thing is healthy personality, what we define. There are some clusters of traits which we feel should be there in a person to label himself as a healthy person. The most important trait is tolerance of pain or loss, disappointment, shame, or guilt, forgiveness of those who have caused an injury with feeling of compassion, acceptance of substitute and ability to delay gratifications, persistence and perseverance in pursuit of goals, openness, flexibility, and creativity in learning to adapt, vitality and power in activities of life. Now, all these things would just give you a brief idea that you need to develop certain level of spiritual quotient to combat or to fight with the problems that you are facing at the time of menopause, like depression, stress, insomnia, or emotional instability. Uh, Basically, every hypnotherapy or hypnosis is self-hypnosis. So it is not that a hypnotherapy will always do a guided session and then you will feel better after that session. But today I am just touching a very superficial aspect, how a self-hypnosis is done. So basically it's a structured 8 steps program in which first of all you decide the work you want to do on yourself during the trance state. The trance state is induced with certain methods. So second is induction of trance state. Third is having a pleasant imagination. Fourth step is doing the actual work that you have decided. The fifth step is to have a pleasant imagination again. Then reorient yourself to the present place and then give some post-hypnotic suggestions like whatever programming I did during this trance will have its influence upon my body and mind consistently even during my waking state. Next time I'll be going in a deeper trance easily and naturally. And the 8th step is to terminate the trance. It's just 2 minutes. The process of hypnotherapy, you have to do assessment and rapport as you do in your clinical practice. It is like eliciting the clinical problem. Preparation of patients, just to explain how hypnotherapy works. Induction and deepening of the patient. Trance utilization, the utilization of the state, re-alerting the patient and giving some post-hypnotic discussion or suggestions. Now, induction and deepening, it could be a ritualistic induction like relaxation techniques, breath awareness or progressive muscular relaxation. There are some other techniques which are not to be discussed here in detail. And there is some conversational technique of inducing the trance state. The most important thing for you to know in this probably short time of 10-15 minutes is how to make an auto suggestion, which probably is helpful in cognitive behavioral therapy also and in hypnotherapy also. So the principles of auto suggestion or self-talk, the most important principle is principle of positivity. In your auto suggestion, you use all positive words. There is a principle of specificity. Consider specific suggestions. There has to be continuous present tense. I am feeling better now. Principle of successive approximation, like day by day as each day passes. Repetition of suggestions, that you should use some synonyms, different form of sentences or languages. Principle of motivational statements towards the end. Use some motivational sentence for long-term benefit. Just an example of sleep auto suggestion. Day by day, I am developing good control over sleep. I am getting deeper and sound sleep. Optimum amount of sleep required for the health of my mind and body. This deep and restful sleep satisfies my body. It makes my body fresh and fine, alert and energetic while I get up in the morning precisely at the decided time. My body is relaxed with optimum mobility of joint. So there are certain suggestions that you need to give. To end up, basically you need to just have daily practice of breath awareness. Most of you must be doing yoga, meditation, so the principle remains same. Breath awareness you need to do frequently, at least once a day. Progressive muscular relaxation once a day for resting and for healing. Trance or mind programming. Breaking the disempowering belief. converting have to into want to. Omkar chanting also helps. Do your level best and accept the result gracefully. So this acceptance is very important, and use now is the right time. Gratitude writing at night before sleeping had helped me and many people. 5 blessings to Almighty and some good things about your subconscious mind. And forgiveness, just repeat this sentence in mind with folded hands. I forgive everyone who has ever hurt me. I seek forgiveness from people I might have hurt, and I forgive myself. I think this is good enough for the short time. Thank you.